Did you know your skin can reveal early warning signs of heart disease? It's not just about what's happening inside. Your skin often gives the first visible clues that something's wrong. Heart disease is often called a silent killer, but your body has its own alarm system. Today, we're breaking down 5 surprising skin changes that could signal serious heart issues. These aren't just cosmetic, they're windows into your cardiovascular health. Spotting these signs early can help you get medical advice before a major event. Don't panic if you notice them, but do pay attention. Let's dive in and learn what your skin might be telling you about your heart. Alright, let's dive into a skin pattern that might look like it belongs on a fashion runway, but actually signals something happening beneath the surface. First up, Livedo Reticularis. We're going to explore what this net-like pattern means, when it's a cause for concern, and what steps you should take if you notice it on your own skin. So, buckle up, as we unravel the mysteries of this vascular phenomenon. Livedo Reticularis presents as a purplish, lace-like fishnet pattern on your skin. It's a distinctive modeling that resembles the intricate design of a fishnet stocking. The discoloration arises from the blood vessels under your skin reacting to temperature changes or, in some cases, indicating an underlying health issue. It's important to note that the appearance can vary from person to person, with some displaying a more pronounced pattern than others. This pattern is often observed on the legs, where the blood vessels are more susceptible to changes in temperature and pressure. However, it can also appear on other parts of the body, such as the arms or torso. The location of the pattern can sometimes provide clues about its underlying cause, so it's essential to pay attention to where you notice it. Now here's a crucial distinction. If it appears after being in the cold, perhaps after a winter walk or a dip in a chilly pool, and fades when you warm up, it's usually harmless. This temporary Livedo Reticularis is simply your blood vessels constricting in response to the cold, and then returning to normal as your body temperature rises. Think of it as your skin's natural reaction to environmental changes. In these cases, it's usually harmless and nothing to worry about. It's a common physiological response, and your skin should return to its normal appearance without any intervention. However, it's the persistent patterns that warrant a closer look, but if it sticks around, if the fishnet pattern becomes a permanent fixture on your skin, it's time to investigate further. Persistent Livedo Reticularis can be a sign of something more serious happening beneath the surface. In these cases, it could mean poor blood flow in your tiny vessels, the capillaries that feed your skin. When these vessels are constricted or blocked, it can lead to the characteristic pattern of Livedo Reticularis. This reduced blood flow can be caused by a variety of factors, some more serious than others. One potential cause of this reduced blood flow, and therefore this pattern, can signal cholesterol embolization syndrome. This is a condition where cholesterol crystals break away from plaques in larger arteries and travel to smaller blood vessels, causing blockages. Cholesterol embolization syndrome occurs when small pieces of plaque break off from the walls of larger arteries, typically those affected by atherosclerosis. These plaques are essentially deposits of cholesterol and other substances that build up over time, narrowing the arteries and increasing the risk of blockages. Once these plaque fragments break off, they travel through the bloodstream and block blood flow in smaller vessels, including those in the skin. This blockage deprives the tissues of oxygen and nutrients, leading to the development of Livedo Reticularis. These blockages can affect not just your skin, causing the visible fishnet pattern. The skin is often the first place these blockages are noticed, but the effects can extend far beyond the surface. The cholesterol emboli can travel throughout the body, potentially affecting your kidneys, brain, and heart. This is because the circulatory system is interconnected, and blockages in one area can have ripple effects throughout the entire system. The consequences can be serious, leading to organ damage and dysfunction. Cholesterol embolization syndrome is most common after vascular procedures, such as angioplasty or bypass surgery. These procedures can sometimes dislodge plaque fragments, increasing the risk of embolization. It's also more prevalent in people with severe atherosclerosis, a condition characterized by the buildup of plaque in the arteries. The more plaque present, the higher the risk of fragments breaking off and causing blockages. So if you see this pattern persistently, meaning it doesn't fade with warmth and is always present, it's a signal that something might be amiss. Don't dismiss it as just a cosmetic issue, especially if it's accompanied by pain or sores in the affected area. This is a red flag. These symptoms suggest that the reduced blood flow is causing tissue damage, and prompt medical attention is needed. And certainly if you have heart disease risk factors such as high cholesterol, high blood pressure, smoking, or a family history of heart disease, you should be extra vigilant. These factors increase your risk of atherosclerosis and consequently, cholesterol embolization syndrome. In any of these scenarios, see a doctor right away. Don't delay seeking medical attention, as early diagnosis and treatment can significantly improve outcomes. Diagnosis may involve blood tests to assess kidney function and cholesterol levels, imaging studies to visualize the arteries, or a skin biopsy to examine the affected tissue under a microscope. These tests can help determine the underlying cause of the Livedo Reticularis and guide treatment decisions. Treatment focuses on lowering cholesterol levels to prevent further plaque buildup and reduce the risk of embolization. This often involves lifestyle changes, such as diet and exercise, as well as medication, such as statins. Treatment also focuses on preventing more blockages by addressing underlying cardiovascular issues and potentially using anticoagulant medications to improve blood flow. Managing blood pressure and quitting smoking are also crucial steps in preventing further complications. Don't ignore this pattern. Livedo Reticularis is not just a cosmetic concern, it's a potential warning sign of a more serious underlying condition. It's your circulatory system sending an SOS, a signal that something is not right and needs to be investigated. Listen to your body, and take action if you notice this pattern on your skin. Comment "skin" below if you've ever seen this pattern, either on yourself or someone you know. Sharing your experiences can help raise awareness and encourage others to seek medical attention if needed. Let's work together to spread knowledge and promote early detection of potential health issues. Alright, let's shift our focus and talk about Xanthelasmas. These little markers on your skin can tell a bigger story about what's happening inside your body. We're going to delve into what they are, what causes them, and why it's important to pay attention to them. Think of it as decoding a subtle message your body is sending you. Xanthelasmas are characterized by yellowish, soft bumps that appear around your eyelids. They can vary in size, sometimes appearing as small, barely noticeable spots, and other times forming larger, more prominent patches. They're usually painless and don't cause any discomfort, which is why many people tend to ignore them initially. But their presence is a signal that shouldn't be overlooked. So, what exactly are these bumps made of? Well, they're essentially cholesterol deposits that have accumulated under the skin. Cholesterol, a waxy substance found in your blood, is essential for building healthy cells. However, when there's too much cholesterol in your blood, it can start to deposit in various parts of your body, including the delicate skin around your eyes. And this brings us to a crucial point. Xanthelasmas can often be an early sign of high cholesterol, also known as hyperlipidemia. High cholesterol doesn't usually cause any noticeable symptoms on its own, which is why it's often called a silent killer. The appearance of these yellowish bumps can be the first visible clue that your cholesterol levels are not where they should be. It's estimated that about half of people with Xanthelasmas have elevated cholesterol levels. This is a significant percentage, highlighting the strong association between these skin bumps and underlying cholesterol issues. However, it's important to note that not everyone with Xanthelasmas has high cholesterol, but the correlation is strong enough to warrant further investigation. Because of this connection, the appearance of Xanthelasmas is a strong clue to get your cholesterol levels checked by a healthcare professional. A simple blood test, called a lipid panel, can determine your cholesterol levels and help assess your risk for heart disease. Don't delay in scheduling an appointment with your doctor if you notice these bumps. Why is high cholesterol such a concern? Well, over time, high cholesterol leads to the buildup of plaque inside your arteries. This plaque is made up of cholesterol, fat, and other substances, and it can harden and narrow your arteries, restricting blood flow to your heart and other organs. This plaque buildup significantly raises your risk for serious cardiovascular events, such as heart attacks and strokes. When plaque ruptures, it can form a blood clot that blocks an artery, leading to a heart attack if it blocks an artery in the heart, or a stroke if it blocks an artery in the brain. In some cases, the appearance of these bumps can signal a genetic condition that predisposes individuals to high cholesterol levels. These genetic conditions can cause high cholesterol even in people who maintain a healthy lifestyle. One such condition is called familial hypercholesterolemia, or FH. This is an inherited disorder that causes dangerously high cholesterol levels from a very young age, often leading to early heart disease if left untreated. Individuals with familial hypercholesterolemia can have extremely elevated cholesterol levels, even in their teens and 20s. Early diagnosis and treatment are crucial for preventing the development of heart disease in these individuals. While it's possible to have xanthelasmas surgically removed for cosmetic reasons, it's important to understand that removing the bumps won't fix the underlying problem of high cholesterol. In fact, they'll very likely return if your cholesterol levels remain high. Addressing the root cause of the problem is essential for long-term health. Therefore, if you spot these yellowish bumps around your eyes, especially if you're relatively young or have a family history of heart disease or high cholesterol, it's crucial to take action. The first step is to get a lipid panel, a simple blood test that measures your cholesterol levels, including your total cholesterol, LDL cholesterol, the bad cholesterol, HDL cholesterol, the good cholesterol, and triglycerides. If your cholesterol levels are elevated, treatment typically includes lifestyle modifications, such as adopting a heart-healthy diet that's low in saturated and trans fats, and engaging in regular physical activity. In many cases, lifestyle changes alone may not be enough to lower cholesterol levels sufficiently, and medication, such as statins, may also be necessary. So, don't ignore these seemingly harmless bumps around your eyes. They could be a vital warning sign that something more serious is going on beneath the surface. They're a visible warning about your potential heart risk, urging you to take proactive steps to protect your cardiovascular health. Take action early, consult with your doctor, and prioritize a heart-healthy lifestyle to protect your cardiovascular health and well-being for years to come. Remember, early detection and intervention can make a significant difference in preventing heart disease and stroke. Now let's turn our attention to Janeway lesions. These are subtle but significant skin manifestations that can provide crucial clues about underlying health issues. We're going to delve into what they look like, where they appear, and why recognizing them is so important. Think of them as little red flags waving on the surface of your skin, potentially signaling a deeper problem within your body. Janeway lesions are characterized as small, typically painless, red or brown spots. They're not raised like a rash but rather flat against the skin. The color can vary from a bright red to a deeper brownish-red hue. What makes them particularly noteworthy is their appearance and what they indicate about your overall health. They are subtle, often easily overlooked, but their presence can be a key indicator of a serious underlying condition. These distinctive spots typically appear on your palms or soles. It's important to note that they are not usually found on other parts of the body. The location on the palms and soles is a key characteristic that helps differentiate them from other skin conditions. So when examining your skin, pay special attention to these areas. They're easy to miss, especially if you're not actively looking for them. They are small and painless, so they don't typically cause any discomfort that would draw your attention to them. This is why regular self-examination, particularly if you have any risk factors for heart conditions, is so important, but can be a sign of infective endocarditis, a serious and potentially life-threatening condition. Infective endocarditis is an infection of the inner lining of the heart chambers and heart valves. Recognizing Janeway lesions can be a critical step in the early diagnosis and treatment of this dangerous infection. Infective endocarditis is a dangerous infection of the heart's inner lining, known as the endocardium, or the heart valves themselves. This infection occurs when bacteria or other germs enter the bloodstream and travel to the heart, where they can attach to damaged or artificial heart valves or to the lining of the heart. These spots form when tiny clumps of bacteria, called septic emboli, break off from infected heart valves. These bacterial clumps are essentially small infected masses that detach from the primary site of infection within the heart. These septic emboli break off from infected heart valves and enter the bloodstream. This is a critical step in the development of Janeway lesions, as these emboli are the direct cause of the spots appearing on the skin. Once in the bloodstream, these bacterial clumps travel throughout the body and eventually lodge in small blood vessels in your skin, particularly in the palms and soles. This lodging of the septic emboli causes localized inflammation and damage to the blood vessels, resulting in the characteristic red or brown spots of Janeway lesions. People with pre-existing heart valve problems, such as those with artificial heart valves or damaged valves due to previous infections, are at a higher risk of developing infective endocarditis and, consequently, Janeway lesions. The damaged valves provide a rough surface for bacteria to adhere to and colonize. Also, those who use IV drugs are at higher risk, as they are more likely to introduce bacteria directly into their bloodstream. This direct introduction of bacteria bypasses the body's natural defenses and increases the likelihood of infection reaching the heart. While certain groups are at higher risk, it's important to remember that endocarditis, and therefore Janeway lesions, can happen to anyone. No one is completely immune, and vigilance is key for everyone. If you see these spots and also have other symptoms like fever, chills, or unexplained fatigue, it's crucial to seek medical attention immediately. These symptoms, combined with the presence of Janeway lesions, are strong indicators of a potential endocarditis infection. In such cases, seek emergency care without delay. Endocarditis is a rapidly progressing infection that requires immediate medical intervention. The sooner you receive treatment, the better your chances of a full recovery. Endocarditis can cause significant damage to heart valves if left untreated. This damage can lead to serious complications, such as heart failure, stroke, and other life-threatening conditions. Tragically, endocarditis is fatal without prompt and appropriate treatment. The infection can spread rapidly, overwhelming the body's defenses and leading to organ failure. Doctors diagnose endocarditis through a combination of blood tests to identify the presence of bacteria and heart imaging techniques, such as echocardiograms, to assess the condition of the heart valves. These diagnostic tools help confirm the infection and determine the extent of the damage. Early recognition of Janeway lesions and prompt medical evaluation are absolutely critical for successful treatment and preventing long-term complications. The sooner the infection is identified and treated, the better the outcome for the patient. Remember, these spots are a warning sign that your heart may be in trouble. They are a visual cue that something serious might be happening within your body, and they should never be ignored. Don't wait. Get checked immediately if you notice these spots, especially if you have other symptoms like fever, chills, or fatigue. Your heart health depends on it. Early detection and treatment can make all the difference. Next, check under your nails for splinter hemorrhages, thin, reddish-brown lines running with nail growth. 1 or 2 after trauma is normal, but multiple lines on several nails without injury can signal a serious problem. These can be another sign of infective endocarditis, as tiny clumps from infected heart valves block nail bed vessels. They can also appear in vasculitis, where inflamed blood vessels bleed easily. If you see these lines and have symptoms like fever or fatigue, don't ignore them. Rule out trauma first. If there's no injury, it's a red flag. Multiple unexplained lines mean you should see a doctor. These subtle marks can be early clues to life-threatening conditions. Regularly check your nails, they might reveal more than you think. Show your doctor if you spot them. Finally, cyanosis, when your lips, skin, or nail beds turn blue or purple. This means your blood isn't carrying enough oxygen, often due to severe heart or lung problems. Peripheral cyanosis, blue fingers or toes, can happen in the cold, but central cyanosis, blue lips, tongue, is a medical emergency. In adults, it can signal heart failure, a massive heart attack, or a large blood clot in the lungs. In babies, it may mean a serious heart defect. Central cyanosis is always urgent. Call emergency services immediately. Other warning signs include severe shortness of breath, chest pain, confusion, or loss of consciousness. Don't wait or try to diagnose at home. This is a blaring siren from your body. Immediate treatment is critical to survival. Recognize this sign and act fast. It could save a life. Those are 5 critical skin signs your heart may be in trouble. These clues can appear before a major cardiac event. Don't ignore them. Your skin is a powerful early warning system. Learn to listen. Recognizing these signs and seeking help could save your life or someone you love. Like this video? Subscribe for more life-saving health tips, and comment which sign surprised you most. Stay alert, stay healthy, and keep learning.